Today is the first day of our annual conference. The National Association of Social Workers, the Louisiana chapter, gathers each March, usually in Baton Rouge, to celebrate Social Work Month. And what we usually do is honor social workers throughout the state who have been selected as our annual leadership award winners. And so we have a social worker of the year, and we have a school social worker of the year. We have an outstanding MSW student of the year. We have a public elected official that we selected, as well as a public citizen, all of whom have either practiced extraordinarily in the field of social work or have done amazing things as students or have just subscribed to the social work values as a citizen and created programs that met individual needs, or they're an elected official who in that capacity have really set a high bar, changing the way that things are in our state to make sure that people without voices are actually heard and that laws are passed, to protect citizens and hold people who need to be held accountable. So we have extraordinary people in Louisiana, and we are honoring 5 of those today.
Good afternoon, everybody, and welcome to the capital city. I found out that the social workers were having their annual conference here in Baton Rouge, and it brought great delight to me. Why? I will tell you that when I was in the legislature early on as a young legislator, one of the groups that I attached myself to were the social workers. And I made it a point to be your legislative advocate while I was in the House and the Senate. And so I can't think of anything of my accomplishments in the legislature. Certainly being an advocate for the social workers, I count among the top. And I share that because it was easy for me to embrace the social workers and the goals that you have, because your goals were my goals, and actually they remain my core values as well. Service, social justice, human relationships, integrity, values, those are all the pillars that I share as I try to build a community of peace, prosperity, and progress. So I want to thank you for your work in so many spaces where you make a difference in so many lives. And in closing, I want to congratulate those individuals from Baton Rouge who are being honored. Congratulations to all the honorees, but especially Patrick Mitchell, Tony Bankston, and State Representative Pat Smith. When I left the legislature, Pat Smith remained, and she has been a very strong advocate for education, for social workers, for all the things that we share in our values. So congratulations to Pat Smith as the legislative honoree, to Tony Bankston, the executive director of the Baton Rouge Children's Advocacy Center, and to Patrick Mitchell, all from Baton Rouge. Thank you all for what you do, and God bless you.
Sharon has been an incredible advocate for social workers and our profession during her entire public service. So we're honored that she's here today, and thank you very much for welcoming all of our conference attendees. Well, we'd like to go ahead and get started with our award winners. We have some very exciting ones this year, not that we don't each year, but it is my distinct honor and pleasure to introduce our Social Worker of the Year. So I applaud my executive committee and entire board for allowing me to tell you about Tony. First of all, the Social Worker of the Year Award honors an NASW member who exemplifies the best of the social work profession's values and achievements. Nominees must demonstrate outstanding leadership qualities, contribute to a positive image of the social work profession, and take risks to achieve outstanding results for the profession and the people we serve. In addition, our nominees must make demonstrable differences in areas of social work practice, for instance, advocacy for clients, administration, because we have social workers of the year in years past who have done extraordinary things in administration. Certainly, they need to make differences in social policy and program creation. So NASW Louisiana has selected Antoinette, great name, better known as Tony to her friends and relatives, Tony Quinn Bankston. She's an LCSW and a BAX. She is our Social Worker of the Year, and I want to take a few minutes to really let you know some of the things that Tony has achieved and done during her career as a social worker. First of all, she received her Master of Social Work degree from LSU in 1988. I know I'm dating her, but she's just a little chickadee compared to me. So anyway, she currently serves as the Executive Director of the Baton Rouge Children's Advocacy Center. She's had a varied and accomplished career spanning 30 years. Can you believe it? She looks like a teenager. Anyway, spanning 30 years. She began her social work career at the Family Psychiatry Clinic as a psychotherapist, treating individuals and couples and families, both inpatient and outpatient basis. Shortly thereafter, she began a consulting and contracting business with the Department of Children and Family Services, where she designed and executed group therapy models targeting child sexual trauma survivors and foster children who were transitioning into adoptive homes. She provided in-service training to staff at DCFS, consulted with professionals, including attorneys and government agency personnel, regarding child mental health issues. She served as an adjunct professor and faculty liaison at the LSU School of Social Work. She authored psychosocial group interventions for children, teens, and their families who were displaced by Hurricane Katrina. In addition, she assisted LSU in establishing a temporary shelter for displaced children in the aftermath of Katrina and joined relief and rescue efforts in New Orleans. Tony also served as the mental health director of the Baton Rouge Children's Health Project. She developed and implemented a model of mobile mental health care protocols for child, adolescent, and family mental health service programs through a partnership with the LSU Health Sciences Department of Pediatrics and the Children's Health Fund of New York. She integrated a school-based mental health model with a mobile model of care to expand services from FEMA parks to schools in poverty-impacted areas. She provided supervision for a multidisciplinary mental health team of social workers, licensed professional counselors, art therapists, social work graduate interns, psychologists, and psychiatrists. She also participated in annual advocacy efforts by the Children's Health Fund on Capitol Hill with members of Congress, where she advocated for needed policy changes and funding for children's mental health services. Tony has served as clinical director of Neighbors Keeper, developing and executing a neighborhood-based model of mental health and social service care serving children and families. She developed protocols for a newly formed nonprofit providing holistic and integrative care to families impacted by poverty through a partnership of the Community Initiatives Foundation and the Capital Area Alliance for the Homeless. She developed programs to address the unique needs of approximately 300 families who were displaced by Hurricane Katrina, Rita, and Gustav, and the closure of FEMA trailer villages. She developed programs for the prevention of homelessness here in our Baton Rouge community, including weekly mind-body skills groups for adults and adolescents, and Mommy and Me groups focusing on parent training for single mothers. Tony has provided agency supervision of psychology interns assigned to the project by LSU, and she built capacity of the agency through the development of really important and long-lasting relationships with community partners. She has served as a coordinator and lead clinician of behavioral health services of the Capital Area Alliance for the Homeless, One-Stop Service Center, Catholic Charities Diocese of Baton Rouge. Those of you from Baton Rouge know how long that name is, and it's hard to say. But anyway, it's the homeless group. She was appointed to the One Stop Leadership Team, which spearheaded the design of the new building, which is lovely, by the way, and she developed relationships with community stakeholders to support its implementation. In 2013, Tony became the clinical director of the Baton Rouge Children's Advocacy Center, where she focused on enhancing the existing behavioral health and trauma response program and creating a new program to address the problem of exposure to trauma in children and teens. She provided supervision and team building for clinical staff and participated in community multidisciplinary meetings and provided direct services to children, teens, and their families. Currently, as you know, Tony is the executive director of the Baton Rouge Children's Advocacy Center. She conducts forensic interviews of children and teens impacted by sexual and physical abuse, human trafficking, or who have witnessed domestic violence or homicide. She also serves as faculty and member of the Global Trauma Relief Team of the National Center for Mind-Body Medicine in DC. She provides consultation, training, and supervision to healthcare providers in mind-body medicine, a stress and trauma-focused curriculum. She does this throughout the United States, as well as in Israel, the Gaza territories, and in Haiti. She facilitates mind-body medicine groups to address stress and trauma in disaster-affected and war-impacted regions. Leslie Todd, a local ACSW, who's a friend and colleague of Tony, said in her nomination letter, Tony is an outstanding teacher, therapist, community organizer, and advocate. And she has managed to do all this while nurturing a long marriage and raising 4 children. More power to her. And Leslie goes on to say in her letter, Tony admits that even she can struggle with balancing her life, but her friends, colleagues, and family can always count on her positive attitude, even under the most unimaginable stress. There is no better role model for all of us. Leslie, you couldn't have said it better. Our own Tony Bankston. Please come up.
I'm a social worker, obviously, and this is our annual conference where social workers come from all over the state to network with one another, to get knowledge about the latest in our field, the latest science and knowledge in our field. And then the luncheon itself is a ritual, it's a tradition in our profession in which we all gather to honor, it's 4 or 5 awardees in our profession, or people who are not in our profession but who have helped move our profession forward in some way.
How did you feel whenever you were given this award, or whenever you were notified about it?
Actually, I was really floored. I was shocked and surprised. I've nominated people many times for this award, but had never won, and I've been a social worker over 30 years, and so I was just really surprised and completely honored, kind of flabbergasted, to be honest.
I was shocked. I was stunned. I love doing the work, but that's the difficult challenge for me to accept recognition. But it was very much an honor. My staff, they arranged it where I received a call and they were all there. So it was a wonderful experience. It was just a great honor, but I have to say I was so caught off guard and shocked.
I was informed that I had won it on the regional level, just for the Houma Thibodeau area, and I was actually at work when I received the phone call to inform me that I had won it on the state level, and I couldn't yell, I was so excited. I was just really humbled, because I'm doing what I love, and you don't think you're going to get recognition for doing something that you should love other people and take care of them, and just to be honored in such a way is just amazing. It's a highlight of my career so far.
I was very humbled, and immediately my thoughts went to my team, because the only thing I can claim to have been able to do well is recruit good people. And so we've recruited great caregivers, especially social workers. Edgar Gidbury leads our team, and of course Shelley Weaver, and a number of other social workers that hopefully are here today. And having recruited them, though, they do what they're called to do by God, and I'm their water boy, basically. So I make sure that they can do it. So that's really how it worked out.
We can't do without social workers. Our children need social workers. Our adults need social workers. They deal with every single kind of issue clinically and medically as I can think of. And when you think about social workers dealing with social justice, they're in almost every avenue and venue of education as well. So we could not do anything in this state in education or in our medical field without our social workers, because they're kind of the persons who have all the referrals. They know just how to deal with traumatic situations, and I think we owe a lot of our gratitude to social workers.
One of the main goals, I think, for a lot of us in the social work profession is to learn more about trauma. As you know, it's very prevalent in our society, and it's real important for social workers across a variety of settings to know how to work with trauma. So we really were talking about developing a trauma-informed approach in working with clients, and that basically means taking into account that someone likely has experienced trauma. It's estimated, for example, Ashley, that 70% of the people in the United States have at least at one time encountered a traumatic event. So that's a high number of people in our world.
The average citizen doesn't really realize what social workers do. And we have such a varied field. We are in hospitals and schools and private practice. We're in mental health centers. We work with physicians and psychiatrists. We are in district attorneys' offices and public defenders' offices. I mean, our roles are varied. But what we all have in common is our values and the ethics that we hold dear. And one of our very basic tenets is to do everything we can to help someone in need. And so it's important to us to single out people who have been doing that for a long period of time and just hold them out as role models to the rest of us, to inspire us, because some days we get tired and we think, well, I don't know that I can do anymore, and yet social workers do. So it's important for citizens to know that we are everywhere and we're here to help.
For children, I would say that social workers are much needed. We're very empathetic. We're hardworking. We have a lot of resources. We band together. This conference gives us an opportunity to meet everyone from across our state and kind of come together and realize we're a lot more powerful in numbers than we are by ourselves. For adults, we work in so many different facets as well. I currently work for a day reporting center where we do reentry programs for individuals who are under probation and parole and recently out of incarceration. We do it to reduce recidivism, and social workers work in so many different places. That's why I chose this field, so that I can be so versatile in many areas of need. And that's what a social worker does. They see the need, and then they find a resolution to that need.
I'm hoping that each person will go back to their respective settings, whether it's schools or healthcare or juvenile probation or private practice or behavioral health, that they will take back some of the things that we talked about here and then integrate more of a trauma-informed approach in working with clients in their system. So I'm hoping they will do all that.
I started off my professional career as a social worker, and I loved it. I went to law school and practiced law for a little while, but I tell you what, my social work experience and my education and my values and ethics guided me greatly as an attorney, and I've returned to social work as the executive director of the state chapter.